Clinical urinalysis. On the score of common knowledge, we have skimped the description of laboratory analysis to make room for detailed description of the special knowledge required for a competent clinical urinalysis, without which the urologist is hopelessly at sea. Clinical urinalysis consists in looking at the urine and interpreting what we see therein. It suggests the nature and quantity of substances held in suspension in the urine. It suggests also, in many instances, the part of the urinary tract from which these substances are derived. But it is by no means infallible, and its findings must always be confirmed by laboratory urinalysis and by a physical examination of the patient. These propositions are fundamental. They seem to leave a very small place in the diagnosis for this clinical test, whose only function is to suggest and not to prove. Yet, practically speaking, clinical urinalysis is employed far more constantly than the laboratory tests. At the first examination of a case, it often, very often, gives the suggestion that leads ultimately to correct diagnosis, and in subsequent examinations, it is our chief means of judging the progress of the case. At the patient's first visit, therefore, the urine should be carefully inspected before it is submitted to laboratory tests, though the inferences made from inspection should not be acted upon unless the laboratory confirms them. At subsequent visits, on the other hand, clinical examination of the urine by inspection is always imperative, while laboratory examination is only required from time to time.